So first I'm going to start by washing my hands and verifying the healthcare provider's order. So the patient is complaining of pain in their left knee, and it's ordered to give them Demerol in their right vastus lateralis. So it is ordered 70 milligrams. So the first thing I'm going to do is make sure I have all my supplies. So I have my unused clean gloves, unopened alcohol wipes. I have a 3 milliliter syringe that expires March 31st, 2020, so it's safe to use, and a 22 gauge needle, which expires July 31st, 2023. And I'll be administering the Demerol, which comes in a 50 milligram per milliliter vial and doesn't expire until 12/31/2030, so it is also safe to use, and I have my MAR. So the first thing I'm going to do is my med math. So it is ordered 70 milligrams for one dose, and the vial contains 50 milligrams per milliliter. .4 milliliters is the answer. I'm going to check it one more time. So 70 milligrams is ordered. And it comes in a concentration of 50 milligrams per milliliter. Get 1.4 milliliters. So I got the same answer twice, so it's safe to continue. Next, I'm going to start my first MAR check. So the patient's name is Jamie Hernandez. Their ID is 6/10/51/34/98. Their date of birth is January 1st of 66. Their allergies are penicillin, aspirin, and sulfa, which don't interfere with the drug Demerol, which is being given injection IM in their right vastus lateralis. This drug is ordered at 70 milligrams, which we found to be 1.4 milliliters. It's given PRN for pain every 4 hours and has not been administered yet. So the first administration will be at 8 o'clock. So now I'm going to start my second MAR check. So the patient's name is Jamie Hernandez. The patient ID is 6/10/51/34/98. The date of birth is January 1st of 66, and their allergies are penicillin, aspirin, and sulfa. This does not interfere with the drug Demerol, which is being given injection IM in their right vastus lateralis. It's ordered 70 milligrams, which we found is 1.4 milliliters. And it's given PRN for pain every 4 hours, and it has not been given yet, so it's safe to administer at 8 o'clock. And the vial of Demerol comes in 50 milligrams per milliliter and expires 12/31/2030, so it is safe to administer. So now what I'm going to do is I'm going to start preparing my medication. Going to clean the top of the Demerol vial. Leave that there so that I know I've cleaned it. I'm going to open my syringe. I'm going to open my needle. I'm going to twist the syringe onto the needle, ensuring that it's tight so that it won't break off during injection. Then I'm going to remove the needle cap. I'm going to draw back 1.4 milliliters of air. 1.4 milliliters of air. Next, what I'm going to do is remove the alcohol wipe from the top of the Demerol bottle. Insert the needle. Push the air. Turn the bottle upside down. And I'm going to draw up more than 1.4 milliliters. And after that, I'm going to make sure that there are no bubbles. Okay, so there are no bubbles. So the next thing I'm going to do is I'm going to push back to 1.4 milliliters. Turn the vial over. Perform a one-handed recap of the needle, and 1.4 milliliters. So now what I'm going to do, I'm going to label my syringe. So the patient's name is Jamie Hernandez. administering the drug Demerol, which comes in a concentration of 50 milligrams per milliliter. It's ordered 70 milligrams. And 1.4 milliliters is what we found to be the dosage from the vial. And the date is 2/12/20. The time is 8 o'clock. And my initials. We're going to place that on the syringe. After that, we're going to collect our supplies and we're going to enter the patient's room. Hi, Mr. Hernandez. My name is Emily and I'm going to be your student nurse today. So I would provide for privacy. We're going to be giving an injection in your right vastus lateralis in your leg for your knee pain. And can you go ahead and tell me your name and date of birth? So the patient says that their name and date of birth is Jamie Hernandez and their date of birth is January 1st of 66, which matches their ID band. I'm then going to compare the ID band to the MAR. So Jamie Hernandez is listed on both. January 1st of 66 is listed on both. And the patient ID 610513498 is listed on both as well. So now I'm going to start my final MAR check. I'm going to compare the syringe label to my MAR. So I have Jamie Hernandez on the label as well as the MAR. The drug being given, Demerol, which is also listed on the MAR, comes in a concentration of 50 milligrams per milliliter, ordered 70 milligrams, which is also on the MAR, which we found to be 1.4 milliliters. The date 2/12/20. listed on the MAR, 8 o'clock. So this medication is given PRN for pain every 4 hours and it has not been administered yet. So it will be administered at 8 o'clock. This medication is being given injection IM in the right vastus lateralis and their patient ID is 610513498 and the date of birth is January 1st of 66. So next I'm going to ask Mr. Hernandez if he has any allergies. He states that he's allergic to penicillin, aspirin, and sulfa, which is what I have on my MAR. I'm then going to assess his level of consciousness. He's already told me his name, so I'm going to ask him who the president is and the day of the week. He says that the president is Donald Trump. The day of the week is Wednesday. Mr. Hernandez is alert and oriented ×3. So what I would do is I would raise the bed, lower the bed rails, and I'm going to put my gloves on. After my gloves are on, I'm going to turn Mr. Hernandez on his side. Feel for the greater trochanter. Right there. Yep. The lateral femoral condyle. Turn my fingers inward where they meet. That will be the position for the injection. I'm going to assess the spot for any bruises, edema, redness, tenderness, or masses. I'm going to clean the area, an alcohol swab, leave it sit. After that, I'm going to uncap my injection. Then I will remove the alcohol wipe, pull the skin taut, inject at a 90-degree angle, stabilize, steadily inject the medication, remove the needle, apply gentle pressure, engage the safety, and because the sharps container is next to me, I can dispose of it immediately. After applying gentle pressure, turn Mr. Hernandez over, ask him if he's okay, make sure there's no bleeding, anything like that going on. I would provide for comfort and provide for privacy. After that, I'm going to gather my materials. dispose of them in the garbage. Remove my gloves. Wash my hands. I'll check on Mr. Hernandez, make sure he's still feeling okay, make sure that the spot isn't red or bleeding, and then after that, I will raise the bed rails, lower the bed, and begin my documentation. So it was given on 2/12/20. These are my initials, and with my name signed next to them so that they know who these initials belong to. It's given at 8 o'clock by me in the right vastus lateralis. So after I'm done documenting, I'll wash my hands before I leave the patient's room. Tell Mr. Hernandez that if he needs anything, I'll be back in about an hour, and to use his call light if he needs anything else. Gather my supplies and leave the room.